Everybody, welcome. I'm Dr. Perkins, a board certified OBGYN, and today we're talking about, can PCOS prevent pregnancy? I'm going to just tell you the answer up front in this video that PCOS does not prevent pregnancy in and of itself. But there are so many challenges with PCOS that can make fertility or pregnancy very difficult to achieve, and we're going to talk about that. So in this video, we'll talk about how does PCOS affect fertility, how to help manage PCOS to improve fertility, and my top tips for you in order to achieve that pregnancy. So as I mentioned initially, PCOS does not block pregnancy directly. I've had so many patients who've come to me and say, hey, I'm pregnant and I didn't think I would be because I have PCOS. I hear this all the time. Many people will have unexpected pregnancies because they were told by someone that if you have PCOS that you cannot get pregnant, and that is not the case. I will say that PCOS can make achieving pregnancy much more difficult. And the reason is, one of the first and probably the biggest symptoms of PCOS is that you are not ovulating regularly. What is ovulation? Ovulation is the process of an egg maturing from your ovaries and releasing into your fallopian tubes. That releasing factor is very important because if that egg does not leave the ovaries and get into the fallopian tube, it will never ever meet sperm. And so with PCOS, oftentimes eggs get trapped inside of the ovaries. You have the eggs. They're trying to mature. They're trying to ovulate and be released, but it does not happen because PCOS is such a hormonal state that it causes the eggs to not mature all the way. And our bodies are quite smart. If those eggs are not fully matured, guess what? They will not get to that point of being released. And so with PCOS, these immature eggs stack up inside of the ovaries. And you may be wondering, well, what prevents them from getting to their full level of maturity? Well, hormonal imbalances. That is the main problem with PCOS. You are in a hormonally imbalanced state, and that imbalance leads to your ovaries not functioning the way they should. No ovulation, no pregnancy. Now, would you then say, well, doc, if I'm not ovulating, then PCOS is preventing pregnancy? And you can say that indirectly. But if you were able to get your body to a state where you're hormonally balanced, then your ovaries will function like they should, and ovulation will happen, which means that you can get pregnant. All right, so we're gonna dive into how to make this happen, but also know that with PCOS, there are other things that can cause your ovaries to not function like they should. And the next thing I'd like to mention here is that luteinizing hormone, this is a mainstay of PCOS. It's a hormone that is released by the brain, and it's very important that this hormone is in the right ratio that it ought to be. In PCOS patients, that level is higher than it ought to be, and that leads to your ovaries not ovulating like they should. Another factor that may also impact your ovaries and their functioning in those with PCOS is follicular development. Those same follicles, as I mentioned, that are in the ovaries that are very important to mature an egg. Sometimes with PCOS patients, those follicles may be empty and an egg is actually not really in them. Again, your body is working so hard to create something that may not exist at that time. According to the American College of Obstetricians and Gynecologists, up to 80% of women with PCOS experience infertility due to irregular ovulation. And of note, For those dealing with infertility, PCOS is one of the biggest and most common reasons why a couple may be infertile. Another factor that affects fertility with those with PCOS is estrogen dominance. This is a term that means that you have an overactivity of estrogens, which is one of your female hormones, in your system compared to the average female. Estrogens are very important. We love them. Estrogens helps us to look and feel like a female. It helps us to have our what are considered to be secondary characteristics, or our breasts and our hips and all the things that makes us look like a female. They're really highly linked to your estrogens. And so estrogens are good, but estrogens in excess is bad. And the reason why this can be bad is estrogens may cause your system to actually slow down. It can cause your ovaries to not ovulate like they should. It can cause an increased risk for uterine cancer and so many other things. And so you don't want to be in an estrogen dominant state if possible. If you're trying to get pregnant, you definitely don't want to be estrogen dominant. PCOS may also affect fertility by causing you to be insulin resistant. In fact, 70 to 80% of females with PCOS may have an insulin resistant state. Insulin production affects the way that ovulation occurs. It affects being able to pull your egg from the stores, maturing them and allowing them to be released as well. And so with PCOS, you now have many large factors that may make it so much more difficult for you to achieve pregnancy, which can be very daunting, I understand. But I promise you today that if you become much more balanced with your hormones, that you'll be able to release all of these things that may be binding your ovaries and your eggs so that you can ovulate and you can achieve pregnancy. So how do you go about managing PCOS to help your fertility? Well, because PCOS is such a hormonal state, it's important that we feed our bodies the things that will help it be more balanced. And so the first thing is to make sure that we're not having a ton of processed foods. The problem with processed foods is that you are not only removing a lot of the natural benefits to your food, so vitamins and minerals, all things that are really important for us, you're removing those. But really, we tend to, especially in Western eating, we tend to apply or add a lot more chemicals and preservatives and different things to processed foods. This becomes a problem because as we incorporate more chemicals, more preservatives, more pesticides and different things in our system, these are traveling and going right down into our pelvis, right down to our reproductive organs, right down to our ovaries, affecting them and how they function. If you're with PCOS, if you're trying to create that balance, it is very important that you rid yourself, your diet, your body of chemicals, antibiotics, pesticides, all of that as best as you can so that your reproductive system can be as free as it needs to be able to ovulate and reproduce. I will always put movement and exercise at the forefront or right next to how you are eating and the things that you're eating as well. And so it's very important that you stay in a very active state. You exercise as regularly as you should. It is actually recommended that you participate in about moderate intensity workouts, about 150 minutes per week. That works out to be about 2.5 hours of activity. That could be running, jogging, swimming, it could be taking a fitness class, it could be strength training, it could be any of these things. The key here is to keep moving every single week, at least 2 to 3 times a week, for at least 150 minutes. You may also want to consider using medications as well. Medications such as metformin may help to balance your glucose or sugar levels, which is tied in with insulin resistance, and so that may be helpful. You may also want to consider even supplements as well, such as inositol, which has been proven to help not only stabilize your hormones in PCOS, but also to help you achieve pregnancy as well. So if you're having difficulty or you're like, hey, I'd love to know how I can jumpstart this process, guess what? I have a 7-day challenge that helps you to get started on the process of creating balance with PCOS. So if you'd like to check that out, go ahead and check that link in the description below. On top of that, I have a completely free gift for you today. If you're just like, well, I don't even know if my lifestyle is in line with becoming more balanced with PCOS, I have a simple quiz that will help you get that answer today. And that, again, is below at the link in the description box. Go ahead and check it out and get more information. I'm Dr. Perkins. Thank you so much for being here and for listening. If you're dealing with PCOS and you have questions, go ahead and drop them in the comment below. And of course, like and subscribe to the channel. I'd love to see you again. Thank you for being here. Take care.